Hi guys, welcome back to What in the Nursing, where chaos meets calm. Today we are talking about a condition that can quietly clog up your heart's blood vessels for years without a single symptom. And that's coronary artery disease. Let's break it down. CAD literally spells out what's happening. Coronary arteries are the specific vessels that wrap around the heart and feed it with oxygen rich blood. So in CAD, there's something wrong with these vessels. Put it together, and CAD simply means the arteries feeding your heart are diseased. Specifically, they are narrowing due to atherosclerotic plaques building up inside them. And here's why that narrowing matters so much. Unlike other arteries in the body, the heart has zero backup plan. If its own blood supply gets cut off, the muscles start dying within minutes. How does a healthy artery turn into this? It starts small with damage to the lining of the coronary artery called the endothelium. Once the lining is injured, cholesterol starts sticking to the damaged area. Over time, that buildup hardens into plaque made up of cholesterol and inflammatory cells. As the plaque grows, the artery physically narrows and less blood and oxygen reaches the heart muscles. A plaque doesn't need to fully block an artery to be dangerous. If it's unstable, it can rupture, and the body reacts to the rupture by forming a clot right on top of it. That clot is what causes sudden, complete blockage, and that's how a heart attack happens. The muscles die off because of lack of oxygen. Some risk factors for CAD you simply cannot change: age, since arteries naturally stiffen and accumulate damage over time; gender, men generally face higher risks earlier in life, though the gap narrows after menopause for women; race, certain populations carry higher genetic predisposition; family history, if CAD runs in your family, your risk is higher. Some risk factors you can actually influence. Think of anything that can damage the artery lining, such as smoking, hypertension, diabetes, cholesterol, and obesity. How do we catch it? Because CAD often hides in silence, we rely on tests to catch it before it becomes an emergency. An exercise stress test works by increasing the heart's oxygen demand. If the narrowed artery cannot keep up, symptoms or ECG changes show up under the stress, even if a person feels fine while resting. An ECG may show an ST segment elevation or depression, which can indicate that the heart muscle is not receiving enough oxygen. Coronary angiography goes a step further by injecting dye directly into the coronary arteries, so we can actually see exactly where and how severe the blockage is. And a simple blood test gives us the lipid profile. HDL is the good cholesterol. Think of it as the cleaning crew, clearing cholesterol away from the arteries. And we usually want good things in high amounts, anything greater than 60 milligrams per deciliter. While LDL is the bad cholesterol, it's what actually deposits into the arterial walls. And we want bad things in low amounts, anything less than 100 milligrams per deciliter. We also look at the total cholesterol and triglyceride levels. Here's a twist. Most people with CAD feel completely fine because the artery can narrow significantly before blood flow is restricted enough to cause symptoms. It's usually asymptomatic until it isn't. When symptoms do appear, think chest pain, shortness of breath, sweating, nausea, and dizziness. And here's a clinical pal: older patients and diabetics often suffer from silent ischemia, where they feel no pain at all even with serious blockage, because nerve damage from diabetes or age-related changes can blunt the pain response. So how do we treat CAD? Treatment usually starts with medication. Antihypertensives are used to ease the pressure load on the arteries. Statins lower LDL levels, slowing new plaque formation. Antiplatelets such as aspirin are used to prevent clot formation. And nitrates dilate the coronary arteries directly, easing chest pain by improving blood flow. When medication alone isn't enough, we move to procedures. PCI, also known as a percutaneous coronary intervention, where a catheter with a balloon opens a blocked artery, usually leaving a stent behind to keep it open. Also, CABG, known as coronary artery bypass graft, where a surgeon builds a new pathway around the blockage using a healthy vessel from elsewhere in the body.